First of all, we're going to talk about the case, maybe put Tamaj on the endoscope. I'll come in there in a second. Just tell us what endoscope you have there. The cap does not seem to be sitting very well on the tip of the endoscope.
Yeah. It's a Fujifilm 840 TP with a conical cap. I have multiple times adjusted the cap and it's the best I could get it. Seems to be a bit too small for this endoscope for some reason. So the case is a 77-year-old male patient within the recent history and vocal cord spinocellular carcinoma, squamous carcinoma, who also has a Barrett's, and we have diagnosed a visible lesion, which was biopsied as being high-grade dysplasia, but has the appearance of being something more. This is discussed on the MGT. Sorry?
Okay, so you're giving the game away to Tamaj. So Tamaj needs to make that assessment. I will just make the optical characteristics in here better. Just give me 1 second, Tamaj, while we make a better image in here, and then we would like to look at it together with you.
Well, this is what I was talking about yesterday, about the ST hood on A40 TP. You have to place the slits in the exact right place, otherwise they block the working channel.
Yeah, I'll go and tell them that in a minute. Okay, Tamaj, tell us what you can see.
Well, I didn't do the measurings yet, but we have
Tamaj, focus on the lesion and pause the image, please.
Keep on pushing the button.
Yeah, Tamaj, you have to hold the button down on the Fujiscopes.
Yeah, you have to hold the button down too much.
Right, what's the problem with the image, Tamaj?
It's not
it's
freezing.
got bubbles on it.
Yeah.
So can you put some Infocol down?
I do.
I think you got it right. Come back. Stop now. Stop. Right. Is this high-grade dysplasia, Tamaj? Or what do you think this is?
It's a small nodule on the area of the GOJ.
Okay, that wasn't the question. The biopsy showed high-grade dysplasia in this case, I think.
Yeah, the biopsy, according to the description, it was taken from a nodule that was maybe 2 centimeters above the GOJ.
Okay, I'm asking what you think the pathology of the thing you can see is. Please, can you pause it? We're getting seasick.
Yeah, but how?
You have to hold down the button. Keep on pushing the button.
Okay.
Right. Well, at least that's paused, or was. Can you go back to the junction and pause on the lesion, please? Okay, perfect. Tell us about this, Tamaj, if you don't mind. Can you pause it, please, and keep it paused? Yeah.
Yeah, okay.
Describe, please.
Yeah, so this highlights what the first learning point from me was what I said this morning, that in Barrett's, it is very difficult to delineate lesions. It's at the area of the GOJ, just where the top of the gastric folds are. Looks like a small nodule, probably, but for me, from now until we didn't apply an acetic acid, this is not clearly 100% distinguishable for me from a top of a gastric folds. It includes 2 areas of extra redness, which I don't know, was it present when entering this esophagus, or is it? It was present. Okay, so that is a clue for being not just yeah, I hold down this button, but yeah, okay. Yeah. So this is a clue towards shifting me towards rather not to be top of the gastric folds. But I would, of course, apply acetic acid first to delineate better.
Tamaj, can you hear me? Yeah.
Right. Do me a favor. So I think this is an excellent learning point, which has to do with understanding the optics of the scope that we're using. Okay. So the 840 TP has a CMOS chip, and it focuses at the closest about 2 to 3 millimeters away from the instrument. Okay. And that's different because you guys are used to using Olympus 1500s, right? You put near focus, you get 1 to 1.5 millimeter focusing distance. So in order to look at this lesion appropriately, we need to keep at a focusing distance away. And if you look at your image, right? So I like to take pictures. I like to photograph. There's a camera with me basically everywhere I go. And, you know, in photography, what we say is don't take a picture of the what, but instead take a picture of the why. And what we mean by that is you need to tell a narrative with your images. So firstly, are you happy with the quality of that image? Would you send that image to
Absolutely not. Absolutely not.
Good. So what is it with the quality of that image that's this? Because I can tell you what, yeah, there you go. Exactly.
The focal length is not good. Yeah.
So the focusing distance
Even
is
now.
the problem. Yeah. So keep slightly further away and you will actually see clearer structures. So if you just move your scope slightly away from where you were, you'll see clearer structures. There you go, right? And so the second issue, of course, is that ST hood that you've got on the scope, which is one of those things. It's one of those limitations with this particular scope that we're facing at the moment, which is that the only cap available for it is this narrow ST hood. And you can see the two slits on opposite sides. Here they're at 11 and 5, right? So we need to place those so they're not in the way of the working channel. And that, Tomasz, was the next point I was going to come to, which is how would you achieve magnification with your scope? Well, you would simply ensure...
Underwater.
Yeah, you would go underwater. And like we said yesterday, we mentioned it yesterday, right? You get does anyone remember the number? 1.27 time magnification simply by going underwater, right? And that magnification is not at the expense of focus depth, which means it's free. It's an optically free improvement in the image for us, right? So, but no, that's Dave. That's against the working channel. So
yeah, that's what I was just going to stick this down here and figure out where the working channel was because I'm not so.
It's 7 o'clock on the 840 TP. It's 7 o'clock.
Okay, so where we don't want it there, we want it.
So what can happen is you want it there exactly like that. Exactly.
Oh, that?
Yeah, perfect.
Yeah.
So this is one of those things. So we're getting improvements in terms of the mechanics of the scope, in terms of the size of the scope, in terms of all these things, right? But it comes with some compromises. Those compromises can be worked around, but you have to understand how to do it. So the optics on these new scopes is that they're actually designed to give you magnification, right? High quality magnification when you go underwater. So we stick it at the point where we get good image quality, which, like I said, is further away than you're used to, and then you inject water. Right, or saline, ideally.
So it is something different with this endoscope, isn't it? And it is something different.
Yeah, it's the focusing distance. It's the fact that the Z scopes, the magnification scopes, obviously you can control the focus point. The negative aspect of this is you can't control the focus points, but that's an excellent image, right? So that's at the correct focus. Now, what you could do here is you can simply remove the CO2, put some water in, and you'll get an even close. You'll get a 30% magnification on your image.
No, wait, is this the knife pump?
Yes.
All right, we're just going to put water in a minute. The world's best. The water pump is not the world's best, right? Not really doing much. Is it just, that's better. Yeah, that's much better.
It's important.
Stop a minute. Just relax it a minute. A little bit less, maybe. So we take out all that gas, I guess. We try not to injure the lesion, but is this high-grade dysplasia, Tomasz, do you think?
It might be.
It might be, or what else might it be?
On white light.
This is a good point.
Well, I see no loss of pattern here.
Sure.
There may be extra redness, but yeah, in Barrett's we also are interested in, are there vessel irregularities or are there pit crowdings?
Well, what can be the problem here? Why can you maybe not understand the image so well? What would you like now?
A zoom.
Yeah, magnification. We don't have it, right?
Mm.
So I think that can be a problem. We certainly do have areas, but it can be inflammation, of course, embarrassed. That's always a difficulty.
And it's in the area of 2 to 5.
It's in so Tamaj is saying it's in the area of 2 to 5.